Hello, I'm Dr. Ian Strawford. I'm a cosmetic and wellness doctor, and I'm the medical director of Skin Excellence Clinics. Are you unfortunate to suffer with excessive sweating? And is that excessive sweating having a significant handicap on your lifestyle and affecting your self-confidence and well-being? Is it meaning that you have to go to work and change clothing during the day because of the sweating, or you're worried about excessive body odor? Are you been trying even prescription strength antiperspirants, but find that they just do not offer any relief? Or are you even worried about the excessive use of antiperspirants that contain aluminium and the potential toxicity that may lead to in the long term? There is another solution, and at Skin Excellence Clinics, we have treatments for excessive sweating, which is a medical condition known as hyperhidrosis.
What is hyperhidrosis?
Hyperhidrosis is a medical condition which is classified as excessive sweating. We all obviously sweat, but normally associated with maybe high temperatures or going to the gym and doing some exercise, then it's pretty normal to sweat. But if you're sweating at other times where you're not doing any exercise and the ambient room temperature or external temperature is not particularly hot, yet you're sweating to the point where it's showing on your clothing, then this is classified as hyperhidrosis. It can also affect your hands, so you always have sweaty palms, which might be an embarrassment when you're shaking hands, or even you might have excessive sweat on the face and scalp, so there's always sweat running down, even in non-anxiety provoking situations. This is what we term hyperhidrosis.
How can excessive sweating or hyperhidrosis be treated?
So conventionally, there has not been really any successful treatments for hyperhidrosis. Take, for example, the underarm sweating, which is the commonest cause of hyperhidrosis, the commonest area for hyperhidrosis. Then the treatments have been medical antiperspirants relying on aluminium hydroxides, which in most cases I find are very ineffective. There is a surgical operation to cut the nerves to the sweat glands, but that is major chest surgery and really not much that anybody really wants to undertake for that reason. Botox has been the mainstay of treatment for hyperhidrosis. And Botox injected into the skin, into the area where the sweat glands are, can prove very effective in reducing the amount we sweat.
What areas can be treated?
So technically, any areas where there are sweat glands can be treated with Botox. The commonest areas that we treat is the underarm areas, which is where most people suffer with their hyperhidrosis. But we've treated patients quite successfully on the face and the scalp and even the hands if necessary. So all of these areas can be treated, but I would say that the most common area requested for treatment is the underarms.
How long do the effects of treatment last?
We normally find that when people first have Botox treatment, it's safe to the underarms, then it usually lasts 4 to 6 months. It takes sometimes a month or so to have its full effect, and it depends on the time of year. I find that through the winter time, we get a good length of time out of the treatment. Maybe in the summertime, it might last a little bit shorter.
Is the treatment safe?
Botox treatment for hyperhidrosis is incredibly safe. We're injecting tiny amounts in little areas in the whole area, just into the skin. So it's a comfortable treatment. It's not affecting the nerves. It's not affecting the muscles of the underarm area. It's just purely affecting the muscle that is attached to the sweat gland that constricts the sweat gland and forces the sweat to the surface. So we're just blocking the skin's ability of the sweat glands to actually push that sweat out onto the surface. And that's simply how Botox works.
Are there any other treatments available as an alternative to Botox?
So at Skin Excellence Clinics, we can do a treatment for hyperhidrosis that gives a more longer-term and often permanent result, and that is called Morpheus8 radiofrequency. The principle here is we're injecting through needles radiofrequency energy into the deeper layer of skin where the sweat glands are, And that energy can destroy the sweat glands permanently. So the skin loses the ability in that area or those sweat glands to produce any more sweat. It's a little bit more of an involved treatment than having Botox. And often patients need more than a single treatment. But perhaps after a course of, say, 3 or 4 Morpheus 8 treatments, we've significantly, if not permanently, reduced all of the sweating in that area. And that makes it a long-term treatment solution for those patients who perhaps don't find Botox as effective as they would like, or perhaps would like a treatment that doesn't require repeated treatments such as Botox for their hyperhidrosis.